Welcome to Interventional Orthopedics of Washington. This short video will walk you through what to expect as a new patient and highlight the most important things to remember. At our practice, we specialize in regenerative medicine for orthopedic conditions, using only your own biologic resources. This includes the cervical, thoracic, and lumbar spine, as well as peripheral joints, such as shoulders, hips, knees, ankles, wrists, hands, and elbows. Instead of relying on surgery or medications that only mask symptoms, our treatments are designed to harness your body's natural regenerative capacity to promote true healing. Every procedure we perform is guided by ultrasound or fluoroscopy to ensure precision. We make sure you receive a sufficient dose of your own healing cells and growth factors to create a real therapeutic response. Whether it's platelet-rich plasma, bone marrow concentrate, or fat-derived cell therapy, our goal is always the same: to use your body's natural capacity to stimulate repair, decrease pain, and restore function. It's important to know up front that we do not take insurance. However, if you're under the age of 65, you may be able to submit a superbill to your insurance provider for possible reimbursement. If you are on Medicare or managed Medicare, reimbursement is not allowed, even with a superbill. Each insurance company has different policies, so it's always best to check directly with your provider. When you schedule your consultation, preparation is key. Please send us any imaging such as MRI, X-rays, or CT scans, as well as medical records related to your condition before your appointment. This allows us to review your case thoroughly and be ready to give you the most accurate diagnosis. Without this information, we don't have the full picture, so sending records ahead of time is very important. During your consultation, here's what you can expect. First, we'll carefully review your medical history and talk with you about your symptoms and goals. If you have a peripheral joint issue, such as in the shoulder, knee, or ankle, we'll also perform a diagnostic ultrasound in real time as part of the exam. This gives us a close look at tendons, ligaments, and other soft tissues and helps us connect what we see with what you're feeling. For spine-related conditions, we'll focus more on advanced imaging like MRI and a detailed exam to identify the exact source of your pain. After gathering all of this information, we'll sit down together and discuss your diagnosis. We'll review your treatment options, and if regenerative procedures are appropriate, we'll explain what type of autologous therapy we recommend and why. One of the most important things to remember is that regenerative medicine is a process, not a quick fix. Some patients notice improvement in a few weeks, while for others, it may take several months. But the goal is lasting healing, not temporary relief. We'll also support you with post-procedure guidance and rehab recommendations to help maximize your results. So here are the main take-home points for you as a new patient. We use regenerative medicine to treat orthopedic conditions throughout the body, always with precision image guidance and sufficient dosing. All of our therapies are autologous, meaning we only use your body's own regenerative capacity to help you heal. We do not take any form of insurance at our office, including but not limited to private insurance, Medicare, or Medicaid. Patients with private insurance may be eligible for reimbursement for some services conducted at our office and will be given a superbill upon request after services have been rendered. A superbill contains insurance coding that tells your insurance what services you had at our office, and it is up to their discretion completely whether any reimbursement will be provided to you and how much. Patients of Medicare age may not submit superbills for any services from our office, even if they have private supplemental insurance. Before your consultation, send us your imaging and medical records so we can provide the most accurate diagnosis and treatment plan. At your consultation, expect a thorough review of your history, physical exam, and, if needed, a diagnostic ultrasound. Regenerative medicine takes time. It's about long-term healing, not overnight results. At Interventional Orthopedics of Washington, our mission is to help you get back to the activities you love with safe, effective, and precise autologous regenerative treatments. We look forward to meeting you and starting this journey together. Thank you so much for choosing us.